lanza bombas contra otros pueblos, ni manda miles de aviones a bombardear ciudades. Un día dije que nosotros no podíamos ni enviaríamos nunca o nunca realizaríamos ataques preventivos y sorpresivos contra ningún oscuro rincón del mundo, pero que en cambio nuestro país era capaz de enviar los médicos que se necesiten a los más oscuros rincones del mundo. Médicos y no bombas.
Cuban medical solidarity is one of the few shining points in global health. The last week of May marked the 60th anniversary of the first Cuban medical brigade. The first brigade of health workers went to Algeria to support rebuilding efforts after its liberation from France. As of May 2022, 605,000 health workers from Cuba have served in 165 countries. They have done some extremely important work such as emergency programs for the response to infectious disease, relief work after hurricanes and earthquakes, provision of primary health care. Cuban health workers have also participated in the delivery of more than 2 million children all over the world. Cuba also offers medical training to people from other countries of the global south. Between 2005 and 2016, some 25,000 students were trained at the Latin American School of Medicine. 163 Palestinian students graduated from this school. 50 more are still enrolled in undergraduate or postgraduate courses according to the Cuban Ministry of Public Health. The distribution of health workers in Cuba is also unique. A network of clinics and polyclinics based on the principle of primary health care are scattered around the island. This ensures that care is easily accessible to everyone who needs it, regardless of where they live. Cuba has proved that healthcare can become a powerful means of solidarity and fraternity.
For the past 60 years, the Cuban medical brigades have been very important for health activism all over the world because they have essentially shown that what health activists like those in the People's Health Movement, but also in many other local movements are fighting for, and that is health for all and healthcare based on primary healthcare, is possible and is manageable despite having limited resources at hand. So because of this, Cuban health workers who have traveled all around the world have become an inspiration for many health activists. And they are actually an organization that people look up to when they need to see how some things can be implemented. From the point of view of health activism, the Cuban medical brigades are also important because they show how working on health can overlap with working on international solidarity. So essentially what we have seen in the mainstream and particularly in the global north, when we talk about building health systems and strengthening health systems, is that there has been a very selfish approach to how this is done. So mostly countries are turned towards what they can do to preserve and strengthen their own health systems in the best of cases, but they rarely look to how they can actually use all the things that they have for helping people around the world. And Cuba is doing basically that from the very beginning of the health solidarity program. So that's one. Those are some of the most important points of why the program has been so important for such a long time. And then, of course, going even beyond the program that involves health workers from Cuba going to other places to provide healthcare. Not only in health emergencies, but also in everyday circumstances. So there have been doctors who have provided eye care for people who suffer with problems with vision. But there have also been many pediatricians from Cuba who have traveled to Africa and to other places in the global south, and essentially provided the essential care that that people would go without. In addition to all that, there is also the other parts of the Cuban health system, which is built in a similar way to what the health workforce policies are, including the public production and development of vaccines, of drugs, which is essentially, again, one other source of inspiration for people around the world, because it shows that the current model of a model driven by intellectual property rights can be dismantled. It doesn't have to look that way, and essentially that it's the people's needs that should drive R&D of all the medical products. These are only some of the examples of how Cuba and Cuban healthcare inspire health activism, but those are two things I would like to single out because it's essentially it's something that's missing from most other health systems in the world.